Very excited to see you all here with us today to talk about legal considerations as you all are working to advocate for community health centers. All right. So my name is Sarah Francois. I'm the Director of Grassroots Advocacy here at the National Association of Community Health Centers. Very, very happy to be with you all today. I'm joined by my NAC colleagues on the call, Eurico de la Cruz and Michael King from the Grassroots Advocacy team, as well as a great panel of speakers that are going to navigate us through this very sometimes complicated and I assume scary topic for some. But we want to kind of ease the pressure for you all in feeling great about being able to do advocacy work. You'll find that a lot more, I'm going to already steal one of our speaker, Jackie's words, is permissible than not permissible. You all can do a lot when it comes to advocating for health centers. And so we're excited to be able to share all of that with you. If you want to head to the next slide, Michael. So just a bit of housekeeping as we start off today. We are in a webinar format. So the best way for you to submit your questions, and by the way, we already received a lot of great questions from you all as you were registering for this webinar. So we hope to be able to touch on all of those things. But as questions come up, please be sure that you're typing them in the Q&A box down at the bottom of your kind of control tab on Zoom. We try not to keep questions in the actual chat itself because they tend to get lost. We want you to be able to dialogue with each other there. And let us know where you're joining from. But as it comes to questions, please place those in the Q&A, and then we will start queuing those up and have a couple of brief moments for questions throughout the webinar today, and then towards the end of the session. Next slide, please. I am really excited to hand things over to Jackie Leifer. Jackie Leifer is with Feldman Leifer. She has been, I don't even know how many decades, Jackie, you've been working with NAC and community health centers. And we are so grateful to have you as an expert in our space and really be in our corner. You had done one of these webinars, I think it's almost 2 years ago now, and I think it definitely is time to revive that. Things have certainly changed in our world, but lots of great opportunities to still continue to advocate. So thank you for everything that you've done so far for the health center movement, and we're just looking forward to partnering with you today on this, and I will hand things off to you.
Well, thank you, Sarah. It's only been 47 years, but who's counting? Next slide, please. So let me just start by apologizing. I've gotten a cold and I'm going to sound like Froggy. But if you can bear with me, we've got so much to cover. The most important word being permissible. Advocacy and lobbying are not the same thing, but both are permissible. So we're going to talk about various kinds of advocacy, what counts as lobbying, what doesn't count as lobbying, permissible voter registration activities, education activities, etc. It's rare that I get to spend a whole half hour talking, for the most part, about things you can do, not things you cannot do. I'm not going to read slides to you, but advocacy is a very broad concept. It speaks to taking positions on policy, making recommendations, educating others on issues, and amplifying the voice of others through your grassroots activities. We've given you a variety of examples, and in the questions that you submitted, you asked for examples, so you'll see them spread throughout this presentation. And again, perfectly permissible to ask neighbors and families to support issues, to make legislative visits, to email elected officials, write letters to the newspaper, engage in social media. We're going to talk about some of the boundary lines you don't want to cross, but know that these are all activities that are, oh, did I say permissible? Next slide. All right, so legislative advocacy or lobbying has some boundaries, but frankly, these are boundaries that we easily live within, starting with the fact that we can't use federal grant funds to support the associated costs. But I hope you all know that in Section 330, the statute that authorizes our grant program, we have very flexible authority with respect to the expenditure of non-grant program income. So the dollars that you receive from fees, premiums, third-party reimbursement, state, local, and other funding, if not themselves subject to other restrictions, you can spend those dollars from a HRSA perspective for any purpose that furthers project objectives and not otherwise prohibited. This means, of course, that you have to be able to document your expenditures for lobbying efforts in your accounting records. And we always advise that you allocate some small percentage of staff time to non-grant funds. In other words, many of you allocate all of your federal grant funds to pay for salaries and benefits. I am suggesting that you reserve some very small portion to the extent that staff would engage in legislative advocacy efforts. Now, hold that thought for a moment. I'll get to definitions in a moment. But what is not permissible, okay, I said not, are political campaign activities. Given that you, for the most part, are associated with 501c3 organizations, engagement in political campaign activity could result in the revocation of your tax-exempt status. So very important to know the difference between legislative advocacy and political campaign activity. Next slide, please. So here's the definition. When you engage in efforts to impact the introduction, modification, or repeal of legislation at the federal, state, or local level, that's legislative advocacy. Does not include your efforts to advance or defeat policies at the executive, judicial, or administrative branches. This is strictly focused on legislators. Keep in mind that if you provide objective, educational, nonpartisan information that isn't attached to a legislative ask or a legislative position, that's not even lobbying. That's nonpartisan education and information and doesn't even count to the extent we would count. So any 501c3 organization may engage in what the IRS would call an insubstantial level of lobbying activities without fear of loss of your tax exemption. There is not a health center in this country, to my knowledge, that spends enough time, effort, or money on lobbying to be considered substantial. In the one ruling, IRS ruling on the subject, 5% of an organization's efforts dedicated to lobbying was not considered by the IRS to be substantial. So again, if you're lobbying specifically focused on legislation, federal, state, or local, not executive, judicial, administrative action, in substantial levels, perfectly permissible, but keep in mind the importance of documenting the associated costs and being able to show that those costs were covered by non-grant dollars. Also, as mentioned, keep in mind that there are state laws and even local ordinances on occasion that will restrict your expenditure of their dollars as to lobbying. So you need to keep an eye on those restrictions as well. Next slide, please. Within the definition of lobbying activities, we make a distinction between your direct lobbying efforts and your grassroots lobbying efforts. Take a look. Direct, of course, are efforts by your staff, your board members to communicate directly with legislators, making reference to specific legislation and reflecting a view. You either support it, oppose it, you want it introduced or repealed, even amended. Grassroots are your efforts to communicate with the general public and asking the public with respect to specific legislation and taking a particular view, calling them to action to reach out to their legislators and take a position. Why do we care? Well, we care because the IRS, if you were to make a certain election to test the substantiality of your expenditures on lobbying by a dollars and cents test, as opposed to the more general substantial activities test, there is a distinction in the law between direct and grassroots percentage allocations. Again, I haven't worked with a health center yet in this country that needs to make such an election because the level of your lobbying activity is very small compared to your entire organization's other efforts. When I speak with primary care associations and with NAC, it's an entirely different story where elections to proceed under what's called the expenditure test is or may be advisable so that there's certainty in the amount that can be expended. Next slide. Questions have been raised about recent executive orders' impact on our lobbying efforts. Executive Order 14248 has a section that prioritizes enforcement against lobbying by organizations that receive federal funds. This is a little bit misleading for those of you who don't then look at the actual language that is referred to, the US Code provision, which actually is a reference to what's called the Byrd Amendment, named after former Senator Byrd, who got very annoyed that a West Virginia university used federal grant funds to lobby agencies for federal grants. So that's a very specific lobbying restriction. And in accordance with that restriction, you provide certifications in your grant applications that you either are not lobbying at all, or at least you are not lobbying with federal funds. So this order is prioritizing enforcement with respect to lobbying for your federal grant. And lobbying here, again, not your defined in the same way as the IRS or HRSA defines lobbying, but actually is more focused on lobbying the agencies. Next slide. Sorry. All right, moving to political campaign activities. This is the absolute prohibition. You cannot engage. This applies to the organization as a whole, its directors, meaning board members, employees, and agents speaking on behalf of your health center cannot engage in or conduct political campaign activities. And there is a further definition, activities that support or oppose candidates for elective office, period. To be contrasted with your efforts to impact the introduction, modification, or repeal of legislation, and to be contrasted with your efforts to educate legislators and anyone else about the health center without taking partisan positions. Next slide. So again, to give you examples, political campaign activities include making contributions to a candidate or party, endorsing or promoting candidates via oral or written statements, or wearing badges, in the health center, activities you undertake that would favor or disadvantage a candidate. And of course, when do you get phone calls from various legislators to come to the health center and make an appearance? Always a month before the actual election. In that respect, certain precautions need to be taken. Perfectly okay to have a town hall and invite all candidates. Inviting one candidate without inviting the other could be problematic. Publishing candidate statements. Again, if you're publishing everybody's statements and no one could argue that it's clear you've taken one position versus another, this is where you wind up in gray areas and phone calls made to the FEC. Next slide.
Jackie, this is Terry. I just was going to weigh in if it was a good time to say what often occurs in your conversations with staff, with the board, is please do note that on your own time, in your own as a citizen, you can engage in these activities. You cannot do it as our agent. You cannot do it when you're.
So I got sort of in and out reception, but let me say, and absolutely important to say, everyone has First Amendment rights. You have the right to get as involved in elections as you wish, but not with the health center's name. And you'll see this on a later slide. Not using the health center's name, not using a fax machine, a telephone, computers, even the facility, which of course is where appearances tend to get made, in a way that might suggest a partisan position in favor of a particular candidate. So as individuals, you can get involved in political campaign activities to your heart's desire, but not in any way that implies that the health center is involved. All right, so political campaign activities versus issue advocacy. You're permitted to take positions on public policy issues, even on issues that divide candidates for election. So think about the current kerfuffles around, that's a good legal word, around Medicaid, and the fact that you as a health center are very likely to take strong positions on Medicaid and the import of there not being reductions in Medicaid benefits or reimbursement for health centers and the like. But what you can't do in that message is favor or oppose a candidate. So if you're doing issue advocacy that functions as a political campaign intervention, again, you're winding up in that dicey area of political activities that could come back to haunt the health center. Communication in this regard is always considered as a matter of facts and circumstances. So does your statement on policy actually identify candidates? Does it express approval or disapproval for candidates' positions or actions? Does it refer to the election or voting? And is the timing connected to an election or a non-electoral event? So again, permissible to take position on public policy issues. I'm thinking Medicaid being one of the most obvious, funding for health centers, continuous appropriations, another, but avoid advocacy that could wind up functioning as political campaign intervention. And for more information, we've given you an IRS revenue ruling citation. Next slide. Keep in mind that health centers are actually required to do outreach and health education in your communities, and you should be training staff to provide outreach and health education. On the other hand, let's be careful about using grassroots advocacy as an opportunity to market the health center services to individuals who may have an other primary care provider. This is not an IRS issue. This is an Inspector General fraud and abuse issue. So just wanted to make sure I at least mention this. We need to be out there. We need to be providing outreach, including why it's so important to have a medical home, but make a distinction between your health outreach efforts and marketing. Next slide, please. So, best practices. A lot of questions were submitted about whether you should have written policies with respect to lobbying and political activities. And the answer, in my view, is a resounding yes. I think Brent will be speaking to this. Again, extremely important. So the do's and the don'ts in terms of workplace activity, with a major don't being in connection with political activities, but a major do being involved in legislative advocacy in very specific ways. One of the most important messages I can give you that is not a message about legality, but about good practice, is making sure that your workplace activities and social media activities are well coordinated within the health center. Everyone should know who speaks for the health center to legislators, who speaks for the health center in terms of reaching out to the public, who is allowed and authorized to post on social media. Having a free-for-all, in my view, without these kinds of designations of authority, lead to slippage and sometimes compliance problems. Again, I'll let Brent speak to that, maybe with a few examples. Written policies about documentation. So again, we need to document the costs of lobbying so that we could prove on audit that we did not use federal funds to support those costs. Keep in mind that you have been required for the last number of years to tell the federal government how you're going to use the federal grant funds. Given that most of you tell the government that you are going to use those resources to support salaries and benefits, again, minus some small percentage for those staff members who engage in direct or grassroots lobbying. Other expenses of lobbying, like traveling to the Capitol, using copying machines, telephones, computers, could almost by definition be supported by non-federal funds, but better to actually document in case an auditor were to come knocking. If 330 funding fully pays for a position, in other words, you're not taking my advice to allocate a small percentage of every staff position to support by non-grant funds, then you would want to be sure you have staff members scheduling breaks, authorized breaks for those advocacy activities. So folks have said to me, there are times when you have to do your advocacy in the middle of the day. You can't wait until after work. Okay, but presumably staff has certain allocated break time. Use that time to engage, not time, company time. Having a board resolution with respect to advocacy and laying out a process by which management pulls together the team and provides position papers to the board members, to staff members, and any agents speaking on your behalf is a best practice as well. And I've talked about allocating staff time, some percentage to non-grant funds. Next slide. All right, now social media is tricky. It's tricky because its subject, making posts on social media, are subject to the same rules that we've discussed on lobbying and political campaign activities. So making sure you have administrative controls to ensure that you don't inadvertently cross the line into political campaign activities. For example, opening up your Facebook page to the public and immediately publishing all comments without regard to the fact that the public may be filing political statements, election campaign positions, could be quite concerning. So consider whether to require administrative review of all comments from the public before you publish them, if you're going to allow comments from the public to post at all. Determine how and from whom responses would be made to follow up to such comments. And again, keep in mind the same rules we've discussed. Legislative activities, permissible. Political campaign activities, impermissible. Educational activities, absolutely permissible and not even counted as legislative advocacy. Next slide. In terms of your interactions via social media, liking or following other pages and accounts, consider the definitions we've talked about. Perfectly allowable to repost official government pages or accounts, but reacting to posts from other pages, be careful. Follow the same kind of review process in commenting on posts as you would to your own social media pages. Next slide. So here's the do's and don'ts, briefly summarized. If you're going to engage with the candidates, engage with all candidates. Always remain nonpartisan. You can host candidate forums. You can educate about and must educate about health centers to the public, to your community, and certainly permissible with respect to legislators. You can interact with social media profiles, but again, be careful. The rules we've talked about apply, and you may participate in voter registration activities or serve as a polling location. The don'ts, I'm going to let you read. The key here is that those very basic rules apply whether you're handling your legislative advocacy efforts directly or grassroots. With respect to political campaign activity, an absolute don't. Next slide. With respect to voter registration, it is permissible to focus your efforts on casting a net as wide as possible across your community. You cannot focus on ideological groups. You can focus on a geographic area, but don't focus on an area because it has a close race. Next slide.
And actually, that's going to give us a brief moment for questions for you, Jackie. And I just realized that I failed to mention that we also have some amazing health center speakers that have joined us this afternoon from Virginia Garcia Memorial Health Center. And we'll be getting to them in just a second. But I did want to just run through a few questions that are in the chat or that have been submitted in the chat, Jackie. Some of them I'm going to kind of group together so they kind of go together. We have several questions about, you know, utilizing health center phones, computers, emails for responding to action alerts and conducting advocacy activities, and whether or not that is something permissible, or if people should be doing that like on their personal phone.
Oh no, absolutely permissible. See, I promised I would use that word over and over. As long as it's legislative advocacy or education, you can absolutely use the health center's resources. But to the extent you do so, I'm speaking to the CFOs now, when it's legislative advocacy, you want to be able to show through documentation that those costs were not covered by federal grant funds.
And so I think that's the piece, and putting my previous health center hat on here, I think that's the piece where when we were doing fundraising activities and other things, when we're looking at our Section 330 funds and use of those grant funds, we always try to, again, reserve a little bit of staff time on everybody's staffing profile that has not been paid for with federal funds, because that does help you kind of protect you from that a little bit, making sure that that's not happening. So
absolutely. And again, keep in mind that by statute, our non-grant funds, the program income, is subject to a much less onerous standard and can be used to support the associated costs of lobbying, but you need to document that.
Mm-hmm. Question here about speaking to the benefits and downsides of taking the 501H option with the IRS. Wondering if you can just briefly touch on that.
Okay, so I mentioned very early on the expenditures test, which is the 501H election with the IRS. The 501H election allows a 501c3 organization to very precisely figure out how much money it can lawfully spend on direct lobbying and indirect grassroots lobbying without fear of revocation of tax exemption. That said, I made the point that health centers, in my view, never even come close to that 5% I was talking about in one revenue ruling. I'd be shocked to hear of a health center that devotes activities amounting to 2% of its total activities to lobbying. And so whether it's worth it to you to make a 501H election where you then record all of your lobbying expenditures is entirely up to you. Again, very different conversation with your primary care associations and the National Association, where the extent of lobbying for most of the associations that are 501c3s could approach the thresholds and even exceed a substantiality test. Having an expenditure test allows the associations to have certainty.
Great, thank you. There was also a question here about whether maybe you've worked with any FQHCs that have considered establishing an LLC to directly support their political activities.
So the answer is yes. I've also worked with primary care associations that purposely created a subsidiary for lobbying work, or an affiliate, I should say, for lobbying work, excuse me, so that there wouldn't be an issue of exceeding the expenditure set. So on the political activities side, have there been health centers that have wanted to create a PAC, the Political Action Committee? Yes. Have there been associations, primary care associations, and NAC that have created affiliates and wanted to consider creating political action committees and or lobbying affiliates? Yes.
Okay. When it comes to those running for office, I know sometimes those in health centers, you might have board members that serve on your board, or maybe staff members that are running for a local office, right? A local campaign. And how does that impact anything that they're doing with the health center? I'm assuming if they're doing it on their own personal time, that's okay, but will we'll get your official take on it.
So you get an A+, perfectly permissible, but can't bring the campaign into the health center.
Great. This is a good question. When we're doing our general advocacy, like talking about budget cuts that could impact health centers, or talking about, Medicaid and how cuts to that could impact health centers, would you consider that to be general advocacy, or would you consider that to be lobbying?
So depends whether it's connected to a legislative message. So if I'm meeting with a legislator and I talk about the health center for 3 hours, as if they would let you, I never say, therefore, please support Senate Bill 1234. It doesn't even count as lobbying. If I do say, therefore, please support Senate Bill 1234, or something approximating that message, then it's lobbying, and it's perfectly permissible. Again, it's more a question of how you would account for the expenditure being covered by non-grant funds.
Perfect. And one more question here in the Q&A before we move on to our health center panel of speakers. So when it comes to dealing with like executive orders and all sorts of other things, I assume it's probably on the safer side to just talk generally about an executive order or a law and not necessarily reference, a candidate or a specific person that might be tied to said executive orders, especially when you're speaking kind of general terms to the health center audience, right?
Couldn't agree more. Absolutely. By the way, because there are such hot button issues now around, in the executive orders, around DEI and around gender affirming care and so on, you want to be extra vigilant about messaging and having coordinated messaging in your lobbying efforts or even your education efforts.
Great. Well, thank you so much, Jackie. We know you're going to be sticking around for the rest of the presentation as well. And we'll have a little bit more time at the very end for additional questions. So keep putting those in the Q&A box as they come up. But now I'm really excited to introduce both Vanessa and Brent for Virginia Garcia Memorial Health Center in Oregon. They are a health center that does tons of advocacy work, has really figured out the secret sauce and how to implement this. And so I think they are perfect to be able to talk about how we can take everything Jackie just explained and put it into your everyday reality of how you can implement this at the health center. So I'm going to hand it over to Vanessa and really excited to have you here.
Thank you, Sarah, and good afternoon, everyone. My name is Vanessa Robles. I serve Virginia Garcia as our Community Affairs Program Manager. So a lot of my work encompasses supporting our organization with government relations and advocacy work. And I'm really thankful for the opportunity, to share about our programming, and I hope it's helpful to the advocacy that you do at your health center. So let's get started. Next slide, please. So first, I want to start off, as Sarah mentioned, Virginia Garcia, we're located in Oregon, so in the Great Pacific Northwest, and a little bit about our mission. So our mission is to provide high quality, comprehensive, culturally appropriate healthcare to the communities of Washington and Yamhill counties, with a special emphasis on migrant and seasonal farm workers, and for others with barriers to receiving care. Next slide. So Virginia Garcia, we're an organization that's growing very big, thankfully. And, today we serve over 52,000 individuals across both Washington and Yamhill counties. We have 6 primary care clinics, 6 dental clinics, 5 school-based health centers, 1 reproductive health clinic, and 2 mobile outreach clinics. So today, we serve 1 in every 14 residents of Washington and Yamhill counties. Next slide. So the first thing that I want to start off with sharing is that, the advocacy programming that we do at Virginia Garcia is really strong and successful because we have really strong support from our leadership. And this includes our C-suite executives and our health center board of directors. And they're really committed to advocacy. And I'm not sure you can see the stars on them, but this picture here includes Mark Millan, our COO, Gil Munoz, our CEO, and Dr. Byerly, Laura Byerly, she's our Chief Medical Officer. And this picture here is actually from a roundtable discussion that we held with our congressional representative, Congresswoman Suzanne Bonamici. And so this roundtable actually included FQHC leaders from the Northwest, and they gathered to talk about the potential impacts of Medicaid and Medicaid cuts to community health centers. Another, key point from with building advocacy from the top down is we really are committed to advocacy so much. It's one of our strategic initiatives. So for 2024, 2025, one of our strategic initiatives, and that continues, is that we eliminate health disparities in our community. So our patients and staff voices will influence our local, state, and federal policy making process. And so with these commitments and with the support from our leadership, we're able to achieve gold status through NAC's Advocacy Center of Excellence. And next slide, please. I'll share a little bit about what this means, because I think it's really important. And this program is so valuable because it really it lays out a really great foundation for health centers to engage in advocacy. So I won't go through everything, but on the left-hand side, you'll see that these are some of the items for achieving bronze status. So gold status, so these statuses through ACE, they're tiered. So it's bronze status, silver, and then gold. And in order to be eligible to qualify for silver and gold, we must meet all of these items here listed for bronze. And so Virginia Garcia, here on the right-hand side, these gold requirements, these are some of the more notable items that have got us a lot of points in the program, and how we're able to achieve that status. So this includes registering 75% of our staff and board as advocates, and that's directly through NAC's grassroots advocacy systems. Posting on social media and tagging our electeds, or doing collaboration posts on Instagram. Those have been really popular and well received. Like I mentioned, we hosted a roundtable in March. Also, every February, we've kept up a strong tradition of attending the Policy and Issues Forum in DC, also with NAC. And most recently, last year, we participated in voter registration efforts, and I'll share a little bit more about that down the presentation. Next slide. So, putting kind of theory into practice, one key thing that we do at Virginia Garcia is we really try to operationalize advocacy. So that's two ways that we do that, communicating our commitment and participating in operations. So first, with communicating our commitment, often our external sites are the first, point of contact for the public, our patients, our community, to really know about the work that we're doing. So we commit some time, and we work very closely with our communications team to have an advocacy page and list what we work on externally and also internally through SharePoint. We have our internal facing site. So this is where more opportunities, trainings, and that sort of material is listed for staff. We also integrate advocacy into the onboarding process for new staff. So every about 2 weeks, we onboard new staff, and we actually have an agenda, a section built into the agenda. So we go and we talk to new staff about the advocacy work that we've done in the past and where our current focus is on, and more opportunities to get involved. Another really unique opportunity that we have at our health center is that we have a required advocacy training course for all new staff. So at Virginia Garcia, we call this our nucleus courses, and these are all trainings that involve trauma-informed care and practices. Really just all the new material for the organization. There is one training that is specifically dedicated for advocacy, and it's not we don't take that time, to do grassroots lobbying. It's more educational and really helping staff understand their role in this FQHC system and how they're advocates for patients even beyond clinic walls. And also communicating our commitment. Every month we also give updates to our health center board of directors and also to our foundation board of directors. And every August, we also celebrate National Health Center Week. And if you remember from the bronze requirements, this is one of the key things. And so in August, we hold two community resource fairs, and we take those opportunities to invite elected officials. One, because it's a great opportunity for them to get to know their community, meet patients, meet different community-based organizations, but also to tour our clinics and just know where Virginia Garcia is at right now with our care and with our patients. So it's a great opportunity to build and maintain those relationships with electeds. And moving on to participating in operations. So every week, advocacy is also part of our integrated huddles. So every week, our clinic leaders, they meet, they have they give announcements, escalate any issues. Well, to be part of this huddle, it's also an opportunity for staff to get to know me and to really just have that established connection and communicate any, updates, whether that be legislative or voting election timelines. That's a really great space. I also most recently joined our quality metric huddle, and this has been something new, but we found that it's very helpful also because we get to not only work more with the clinics, but we're able to identify different trends, healthcare trends, and in turn that helps us build strategy and really be knowledgeable about how we're working with and connecting with electeds. We also have patient advisory councils and school health advisory councils. So these councils, members of these councils are volunteers. For students, it's more of a student club. And so they often meet after school or during lunch, but it's all students that know Virginia Garcia and, our patients, for our patient councils. They really know Virginia Garcia, and what they have in common is they're very passionate and supportive of the work that we do. And so these individuals, wanted to take it a step further and really be involved with the work that we do more internally. And so this is also a great opportunity for when we're, needing patient testimonies or patient stories. These councils are often where we look to and, how we connect with the community. Next slide, please. So the next thing I wanted to mention is we really also try to advocate with intention by collaborating with our partners. So we have a very good relationship, very strong and close relationship with our Oregon Primary Care Association. And it's, who we often turn to guide us in legislative engagement here in the state of Oregon. And this picture here is actually from April 3rd, when we were down at the state capitol advocating for 340B. Here in the state, and most legislators, they are very familiar with Virginia Garcia, so it was a good time that day. Another partner that we collaborate very closely with is NAC, and that's for federal advocacy. So when we register our staff and our board as advocates through NAC, they receive advocacy opportunities or ways to engage. With topics currently happening in DC, the most recent example we heard from is Medicaid. And so this year we're taking it a step further. So we actually just added to our organization's scorecard a metric for advocacy engagement. So our goal for this new year is to engage 15% of our staff over a 6-month period. And that goal is specifically taken from the ACE program with NAC. And so that's how that's how it's all connected. And this is why I mentioned that program lays out a really strong foundation for the work that we can do at our health center. Next slide, please. The next, very intentional program that we have is the RISE program at Virginia Garcia. So RISE stands for Reach, Inspire, Support, and Engage. And it's an internal advocacy training program. And this picture here is from our most recent cohort, our graduating cohort from 2024. Over the years, it has changed a little bit between, it's a training program that in the past has lasted 6 months or 4 months. Most recently, that's what we did last year. The cohort meets once a month. We did meet during our lunch hour this past year, but this program is for those individuals that really want to take it a step further and get more involved in advocacy. So in this program, we had a variety of speakers, and this included, speakers and topics of all things advocacy and all things skills you might need to be an advocate. So it included a speaker from our Primary Care Association, really coming to talk about, the nuts and bolts of the legislative system, what the legislative world looks like for FQHCs right now, at least in the state, what the different roles of government are. But also we had speakers come and talk to our cohort about storytelling and public speaking and developing their leadership skills. And so this program was very well received. This past year, it was one of the larger cohorts that we've had. We started off with 18 individuals, but due to clinic life gets very busy, it came down to 12. But it's a program that's very popular, very high demand, and we're looking forward to continuing that in the fall. Next slide, please. And the last bullet point here that I wanted to share is, about the work that we did in 2024. We were able to be part of the Community Civic Engagement Program through VoteER. And I know VoteER works very closely with NAC as well. And I'm happy to send more information included in the slides afterwards. So participating in this program, we were a grant recipient, so we were able to get some resources to do voter outreach and voter engagement. Last year, we were able to host 2 voter education nights, one in each county that we serve. And they were very well received by the public. And this event here, pictured here, this is for our Washington County voter education night. So the way we did that is we partnered with our local county, because since they count the ballots, we just reached out and we said, hey, can you come and present, talk to people about voting, but not just, who's eligible, how do you register? We wanted to take it a step further and really tell people about, how is your ballot tracked? How is your ballot counted? For those of you who are not familiar, Oregon is an all vote by mail state. So we have that very unique process here. And at this particular event that's pictured, we hosted it at our local library, and our now former mayor came out that day and gave the opening address and really told people why voting is so important, especially at a local level. And also here, just 2 quotes that I received from people in the audience. One is, I'm a first-time voter, and this event was really helpful for me. And then the second quote, I wish that there were more events like this for people to learn. And so I'll say that our audience was very diverse. We did host the events in a bilingual format. And the audience members, they were first-time voters and also long-time voters that just wanted to get more information. So we had great turnout and great feedback at this event. Next slide, please. And so just some key takeaways that I'd like to leave you all with. At Virginia Garcia, advocacy is really framed as a core leadership skill in public health. And so this is a skill that's important for everybody to have, not just leadership, but also our people in the clinics. They should really know. It kind of goes into my second point with representation matters. So when people with diverse lived experiences engage in advocacy, they bring valuable insights and shape more inclusive and effective solutions. So it's important. Representation is important, including, gender and race, but also with the experience that people bring as MAs, as dental assistants, nurses, and really helping them understand what their role is in this larger FQHC system. And I found that that's really what people would like to know. And so that's this understanding the system is what we try to include in our trainings. And then advocacy is also about celebrating your health center's impact and speaking up collectively. So, celebrating our successes, but also when we see something's not okay, also taking action and speaking to that. And through advocacy, of course, we help build healthier and more engaged communities. And so with that, I'll transition over to our compliance and financial accountability. And I'll hand it over to Brent to introduce himself a little bit and talk about our approaches and our methods at Virginia Garcia.
Okay, so you can go to the next slide. All right, so the one lesson that I want to share from this slide, and it took me a number of years to really learn this, is that policies and procedures are not what I call self-actuating. You can write a fantastic policy, you can write a fantastic procedure, but they don't do anything, on their own. You have to have processes in place to ensure that you get the policy and procedure into the hands of the individuals, that it applies to. You educate them to the policy procedure, and you give them the resources necessary to be able to operationalize the policy and procedure, and then you can follow the policies and procedure. So having policies and procedures, that describe the processes in compliance with the requirements, is an essential first step, but it's not sufficient. It's like getting a box of Legos. It's not going to self-assemble itself. Somebody has to sit down, and put it together. So some of the policies that Virginia Garcia has is a social media policy, lobbying activity tracking procedure, advocacy and lobbying policy, and advocacy alert response protocol. But what you really want to have is you want to have in place processes, so that everybody, within an organization, that is faced with two competing choices, that they either intuitively know what the right thing to do is, or, if it is a little bit more complicated, they know where to go to get the answer. And that's where your policies and procedures will come into play. But they can only go there to find the answers if they know that the policy or procedure exists, or they know the individual, to go to. All right, so you can go to the next slide. So before I was a lawyer, before I went to law school, I actually worked in an improvisational theater in Chicago. I worked at the Second City with Chris Farley, Steve Carell, Steve Colbert, Jane Lynch, Tina Fey. I was there, a long time ago. So one of the things that I'm going to try to do is, and it's very hard for lawyers to do this, is I'm going to try to speak, in plain English. So I have slides that just have pictures. So what I want to try to help you do is help you visualize, these rules. So I'm going to help you visualize boxes, bags, and strings. So we're going to talk about boxes, we're going to talk about bags inside the boxes, and we're going to talk about strings that are attached, to those bags. So let's start with the box. So your box is your 501c3. So your 501c3 is going to be as big as it needs to be. So say you have 50 individuals, 50 FTEs within your clinic. Your box might be the size of 2 shipping containers. If you're a larger organization like Virginia, Garcia, your box might be the size of like a CVS or a Walgreens. For a 501c3, the rules apply to the entire box. So what you're allowed to do, what you're permitted to do inside the box, are those things that are allowable to a 501c3. Anything that is not permissible, needs to happen outside the box. You need to leave the box to do those activities. Political campaign intervention are things that are prohibited for a 501c3. So it can't happen in the box anywhere. It doesn't really matter where the money's coming from. For a 501c3, outside the box activities are going to be political campaign interventions. Inside the box activities that are permissible, will be issue advocacy. So you need to understand, what. If you're a 501, C3, these are the rules. You can do issue advocacy inside the box, but any political campaign intervention needs to happen outside the box. You can't run to a corner inside the box and do political campaign intervention. You can't pick up a phone that's inside the box and do political campaign intervention. You can't post to social media, to your social media accounts that are going to be political campaign interventions. All those activities, you need to leave the box. You need to be able to do those. Once you're outside, the box, then you're free to do whatever politics that you want to. So for a 501c3, you have activities that you can do inside the box, issue advocacy, and you can do some of that issue advocacy, grassroots advocacy outside the box. but any political campaign intervention needs to happen outside the box. All right, so you go to the next slide. All right, so who can tell me, and you can put it in the chat, what is important about November 3, 2026? What is going to happen on Tuesday, November 3rd, 2026? Well, the correct answer is it's my birthday. My birthday happens to be on November 3rd, and once every about 14 years, it happens to be a federal election. There also happens to be a secondary event on November 3, 2026, which is going to be, the next round of federal elections where the entire House of Representatives will be up for election, and about 1/3 of the Senate will be up for election. As we get closer to my birthday in 2026, the activities that would be advocacy. You just need to be more careful, that they don't become political campaign intervention activities. Right now, all your elected officials are elected officials. I don't think any of them have yet, announced their candidacy for 2026. So you're relatively safe to be able to engage with those elected officials and engage in issue advocacy, and engage in education. As we get closer and closer to November 3, 2026, my birthday in 2026, then you need to be a little bit more careful, about those activities that you're doing, that you differentiate the activities that are being directed towards the elected official, versus those activities that may be directed to the candidates, recognizing that the entire House of Representatives that choose to run for re-election, are going to have two hats. As we get closer to 2026, they're going to be the elected official, but they're also going to be a candidate, for that role. As long as you recognize that, as long as we get closer to November 3, 2026, and you sort those activities out, you'll be more likely to be safe and then comply with the policies and procedures. All right, so let's go to my third slide. All right, so I promised that we're going to talk about boxes, bags, and strings. So the bags in the organization are your sources of funds. Hopefully, your bags of funds are behind your chief financial officer. So you need to go through your chief financial officer to get access, to your bag. So that'll be internal control number one. Internal control number two is when you receive these bags of funds, what you don't want to do is you don't want to take these bags and dump them, on the floor and commingle, all the funds. You want to keep the funds, in their bag because there are strings attached to the bags, and it's not the same string, that is attached to your 330 bag is not the same string that's going to be attached to an NIH grant, or a state grant, or a local grant, or a private grant. Each of those bags are going to, have strings that are attached to it, and you need to be able to pull on that string, to be able to identify, which rules are attached to those bags. For your 330 bag, you have certain rules that are attached to it. One of the things that's important, and Jackie touched on this, is, lawyers are going to encourage to stay away from two numbers you generally want to stay away from. You want to stay away from 0, and you want to stay away from 100, because, if you say, 0% of an employee's activity, is lobbying, then 1 minute of lobbying activity, would violate, we would violate that. Or if you have 100%, we want to avoid having 100% of an employee's salary to be covered by the 330 grant. You can do that, but if you do that, then the 330 grant strings apply to 100% of their activities. It is usually much safer, to operate between 0 and 100, and that's what Virginia Garcia does. We operate around 20%, where approximately 20% of the clinical staff salaries are covered by the 330 grant, which would leave about 70–80% for each of those, employees. When you have employees that are funded by multiple sources, you're going to have multiple strings attached to that individual. So whenever you go into those bags that are behind the chief financial officer, you need to have good internal controls. When somebody goes in there, and takes out, a package of $20 bills for an activity, that you have processes in place to be able, to log that is being taken out of the 330 grant for that purpose. some of your bags are inelastic and some of your bags are elastic. And by that, what I mean is some of your bags can accrue program income and get bigger, and some of your bags might accrue program income and stay the same size. And that's something for the chief financial officer, to be aware of, which of your funds, are allowed to essentially grow, and make the amount of money that's in that bag bigger, and which of the funds, are inelastic. They're not, allowed to grow. You need to be able to also track the program income, because there's going to be program income requirements that get attached to those funds. But as long as you keep the money in bags and you haven't tossed it on the floor behind the chief financial officer, and you have good internal controls, where money is pulled from the bag only for, a reasonable, allocable, and allowable purpose, and you log it, you'll be in a pretty good shape. The only thing that gets a little more complicated is if you're allowed, to earn a program income, where does that program income go? Is it allowed to be added on top of the, the other money that's inside of the bag? And then what strings are attached to those program income? So as long as you're able to understand boxes, bags, and strings, you're able to navigate, the majority of the rules. So for the box, it's a 501c3. Certain activities can happen inside the 501c3. If it's not permitted to happen in a 501c3, it doesn't matter who you are, you need to leave the box, to do that activity. You have bags, that are going to have strings attached to it. The 330 is going to be probably your largest bag, with the most important string. As long as you keep those segregated, and you have internal controls to be able to account for expenses, that are being charged to those, charged to those bags, and you have mechanisms in place when you have lobbying activities, that those are being charged, where they're being charged from, and they're not being charged. You're not pulling funds from a bag, that prohibits, that type of, activity. You're going to be complying with probably 80–90%. Of the rules. When it gets a little bit more complicated, then you call somebody like Jackie, when you have that trick question. But as long as you understand, FQHCs are by and large 501c3s. We're allowed to do issue advocacy. We're not allowed to do political campaign interventions. If we want to do issue advocacy, we need to be careful as we get closer to my birthday in 2026, November 3rd, that those issue advocacies don't appear to be political campaign interventions, and you keep those bags behind the chief financial officer. You have internal controls in place that you're able to track that, and somebody's keeping track of the strings that are attached, to each of the bags. You're going to be, in compliance with 80–90%, of the rules that get attached to, all of these. So with that, I'll go ahead and turn it back over to the moderators and open it up for questions.
Yeah, thank you so much, Brent and Vanessa. It was awesome to see how you all are implementing advocacy and also getting some of those great reminders about things I had never heard the box, bag, string analogy, but I think we're going to need to make that a real thing for sure. We do have a couple questions in the chat. I know we're getting close on time. So I am just going to level up a few of these questions. One was, Jackie, you had mentioned previously, if you're going and doing a lobby, if you're going to the Hill and you're speaking with a legislator to support Bill XYZ, and that XYZ bill support conversation is 2 minutes out of a 30-minute meeting, does the whole 30-minute meeting count as lobbying?
Yes. Okay. This is a short answer, but so what? Again, all we've talked about is the fact that the expense associated with that 30 minutes needs to be covered by program income or funds that are completely divorced from the grant project entirely.
Leads us into another great question. It's almost as if we just teed it up. So if you are using other program income to support these lobbying activities, even though they're not potentially funded by a 330 grant, should you still be tracking them as lobbying activities in your accounting system? just so that information is there.
Yes, and also keep in mind that there may be strings attached to some of your program income. You know, your program income includes Medicaid, Medicare, third-party reimbursement, state, local, and other funds. We often see state restrictions. And by the way, if you're a public entity health center, you're probably, or another public entity, you may have Hatch Act type restrictions that may reach beyond the definitions that we've given of political campaign activities, which again are a no-no, but there may be additional no-nos for public entity health centers.
Awesome. And then our final question that we have here, can you use federal funds, so like Section 330 funds, for example, to cover trips to your state capital or Washington, D.C. to participate in legislative or advocacy efforts?
So I wouldn't use federal grant funds, but keep in mind that very often you are coming to Washington for a NAC conference where there are a bunch of educational sessions that you're attending, excuse me, or board meetings, committee meetings. That's not lobbying activities. So you can allocate what's the percentage of the associated travel expense that is education at NAC conferences versus being up on the Hill and lobbying. Sorry. And the only question is an expense allocation, not can you do it? You can do it.
That's great. I think we got a lot of good takeaways from today's session. I want to remind everybody that we are going to be sending out a copy of the slide deck in addition to a recording of the webinar. Give us a day or two so that we can get the recording downloaded and edited and all that good stuff, and we will push it out to you all who have registered for this webinar and attended. I want to be sure to thank all of our speakers, Jackie, who I know is recovering and drinking her tea over there. Vanessa, Brent, thank you so much for sharing all of your wisdom with us and all of these great tips. I did just want to we have just a couple of additional slides because I want you again to be able to put this all into action. So if we can advance to the next slide. Vanessa mentioned it. Right now, we are in the throes of our Medicaid campaign. So we are asking advocates to contact their elected officials with regards to Medicaid. We anticipate that Congress is going to be starting to release some of that draft legislation next week. So you will probably see new action alerts coming to your inboxes to talk about Medicaid, but we have a bunch of resources there for you all to take a look at. I think we have, you can go to the next slide, Michael. Just wanted to give you, again, Vanessa did a great job promoting all of our awesome programs and other things. Make sure you're signed up to become an advocate and you receive our Washington Update newsletter every Tuesday, because that also gets you access to those action alerts. The Advocacy Center of Excellence program, which Vanessa spent a lot of time talking about. And then we also have our Advocacy Leadership Program, which is a virtual cohort that runs for about 4 months, where we talk more about all this great stuff and engaging with your elected officials. And then finally, Vanessa also had plugged our National Health Center Week. So on the final slide that we have here, our National Health Center Week kickoff webinar is going to be held on May 30th. So just about a month away. It's hard to believe we're already in May. And we are going to be giving you all sorts of tools and tips about ways that you can really engage with advocacy. This is a really fun time of year. It's a great opportunity for you to invite your elected officials to come to you. And it's not during campaign season, which is even better. As Brent mentioned, we don't have to worry about that right now. So you can just invite them to come to your health center, learn more about your programs, and engage with your staff and your patients and community. So again, thank you everyone for participating in this webinar. Thank you to all of our participants who submitted questions ahead of time. We hope that this has been valuable for you all, and we will continue to kind of update these conversations and of course make all these tools and resources available to you. But we hope that this helps you feel really good about the fact that advocacy is permissible, and we are excited to continue this journey with you all. So thanks so much, everybody. Have a great rest of the day and expect these slides to hit your inbox. If not tomorrow, then probably very early next week. Thanks, everyone.